So certainly special thanks to the Levert Foundation to Cure Schizophrenia for helping sponsor our event today. And with that, I'll introduce our first speaker, Dr. Brad Cutler, who'll be talking about living with schizophrenia from the asylum to the community. Brad is the Associate Inpatient Medical Director and Director of Education at Endeavor Health Linden Oaks Hospital, and is currently serving as the President of the Linden Oaks Hospital medical staff. Brad is, despite his youth, very accomplished and completed his medical training at University of Vermont College of Medicine, his residency here in Chicagoland at Rush University Medical Center, where he was chief resident, and then joined Linden Oaks. So very happy to have him and welcome him to the stage.
Thank you, guys. It's a privilege to be here and be with everybody. So thank you. I'm very fortunate. We're very fortunate to treat the patients that we see every day. I'm going to start out by giving about 15, 20 minutes slides on some topics. And then I'm going to have a patient struggling with serious mental illness and his mother come up. And we'll do a little interview. They'll give you some background on his illness and we'll ask some questions. I think it'll be very interesting since we want to talk about living with schizophrenia or serious mental illness. So just to start, okay, this story I find so interesting. Do you guys remember the story of Phineas Gage? Some of us studied it in school. He was working on the railroad in Vermont, where I did a lot of training. I was a lot after that. This was in the 1800s, and this tamping iron went through his head. Tamping iron's like it's like a crowbar, but without the bend. And it was blown through his head. It went back so many feet, and Gage survived, but the reports around him are that he was no longer like himself. He was walking, he was talking, but his personality completely changed. And when I was going over this last night, my daughter, she's 5, she asked me, well, how did he get to the hospital? And I didn't have a good answer. There weren't cars back then, and I don't think it was very easy to get there. But there was a doctor that came pretty quickly and saw him. But what I think this case raises, this is a direct injury to the brain, and it raises a lot of important questions from lots of different people. One of the main questions I feel is, what makes you who you are? Is it your soul, like Locke might say, or your brain, or your mind, or yourself? And that's what I want to talk about in these first few slides, because these illnesses, schizophrenia and other similar conditions, are disorders that affect the self. How do you develop mental illness? How do you treat mental illness? So just very basically, we know our brain's composed of all 86 billion neurons. And this is the organ we're talking about that we're working on in our field. And think about the brain as the letters of the alphabet. But the brain is in the world, and the world is what generates, you being in the world is what generates meaning. And the seed of meaning for who you are, that's the mind part. Think of the mind, the letters as the brain, the mind is Hamlet. And the self is the agent of the mind. It's like Shakespeare writing Hamlet with all those letters. So the self, the mind, and the brain, these are all important components of what's being effective in mental illness. And I'm going to get back to that in a second. So very, very basically, how do you develop mental illness? Your brain takes sensory information, uses pertinent emotions and previous experiences to create an internal representation of the external outside world, which affects our thoughts, our feelings, our behaviors, and it overlaps with other people's because our neural circuits have evolved to be similar to how everyone else's are. That's how things begin usually. And then, and Dr. Insel talks about this too in his book, that mental illness arises like in other conditions, right? When there's cellular and molecular changes in the brain, and that changes the way it changes our internal representation of the outside world, and changes the way we think, feel, and behave. And this can cause serious impairment or disability. It's often referred to as serious mental illness. So how do we treat mental illness? Obviously, very broadly, right? Mental illness affects our sense of self. And this is a very important point in Dr. Insel's book, too. We do not want to confuse illness and identity, right? I think one of the examples is like, I have diabetes, but I am schizophrenic. That's not the language that we want to be using, because These are illnesses that we have like every other illness, but they do affect our sense of ourself. And our sense of self can be so strong and fundamental that we're reluctant to surrender it, even if it causes us to suffer. So we seek to treat our patients' brains and minds, helping them to regain their sense of self. So that goes back to all these three pieces here. If we to regain our sense of self, we have to improve our patients' brains and minds. Okay, serious mental health disorders and mental health in general are among the most common, and they start early. And this is a very important point. So mental illness affects 1 in 5 people in the country, and serious mental illness affects 1 in 20 adults. I should say 1 in 5 adults for the first, and 1 in 20 for serious. Mental illness also, besides being so common, it starts so early. The peak incidence is around age 15, and it's split a little differently for males and females. The median onset for males is 19, and just a year later for females at age 20. So mental illness is common, and it starts early. And what does that mean? That means that it leads to tremendous disability. And if you add up mental health disorders and substance disorders, it leads to the greatest number of years lost to disability of any other conditions. And so in the United States, this is the #1 cause of years lost to disability. And some of these are depression, anxiety, but schizophrenia is right up there also. And that's a very important point. Questions so far? Okay, now the care setting. So the rise and fall of state hospitals, and Dorothea Dix, I was telling my daughter about her yesterday, how she started a lot of hospitals around the country. She visited, this was in the 1800s, almshouses, poorhouses, jails in Massachusetts, and she went around, and by 1845, she had gone 10,000 miles, visited all these penitentiaries, state hospitals. She even started state hospitals, including one in Illinois. And she wrote to the legislature of Massachusetts in 1843, "I call your attention to the present state of insane persons confined within the Commonwealth." This was the language of the time, right? "In cages, closets, cellars, stalls, and pens, chained naked, beaten with rods, and lashed into obedience." This is how things were around the world, and including the United States, until the mid-1800s. And that's when the state hospital systems began being developed across the country, and they became known as asylums. And by the mid-50s, over 500,000 people were in state hospitals. And unfortunately, by the 60s, the quality of care in the hospitals had deteriorated significantly. And that led to the deinstitutionalization, which Dr. Insel talks a lot about in his book, and I just wanted to bring up a few points here, is that deinstitutionalization is when patients came out of the state hospitals, those 600,000, and into the community. So first there was the development of Thorazine. That was the first antipsychotic that was being used. That helped treat symptoms, although it led to a lot of side effects. And then in the 60s, 63, Kennedy signs the Community Mental Health Act. And he stated that the Community Mental Health Center, the CMHCs, would constitute a bold new approach, the reliance on which the cold mercy and custodial isolation will be supplanted by open warmth of the community. So that isolation that was becoming an issue in the state hospitals or the asylums, we're going to bring our patients out into the community, and we're going to have these community mental health centers take care of our patients. And to go along with that, President Johnson in the 60s signs the Social Security Act, which gives more federal funding to patients. So Social Security income, disability, Medicare, Medicaid becomes available. So this is a confluence of factors happening at the same time. And by the 70s, as all the patients are coming out of the asylums, remember there were 600,000 patients in there, and just 20 years later, we're down to under 200,000. So you can see all these patients coming out of the community. And you can see the drop of inpatients on the chart here. But community care, and I think that's a big point of today's topics, our community care has not been perfect, and it's failed in many, many ways. These community mental health centers did not reach the patients that were in the asylums. Most of the patients in the asylums never made it to these centers. because they treated less severely ill patients. And the funding changed as well. And this especially happened in the 80s, where there was not the funding available to get the help you needed. And another issue is all these patients that came out of the asylums many of them didn't even have families to take care of them to begin with. So where were they going to go? They went on the streets and cheap hotels and nursing homes. And then right now, our jail systems are some of the biggest places where our patients are living. And Cook County Jail is one of the biggest. And so you can see as the number of people in these state hospitals increase, the number of people in prisons and jails, it's the dark green line, it's been going up. And that's a very important point we want to bring up. So community care has failed in many ways. And there's some new things, and there's new funding. There's new federal funding that we'll talk about, and that there's new phone number, right, that everyone, the 988 number that everyone can call. So there are new things on the horizon, but we still have a long way to go. So patients receive hospital care, right, in emergency rooms. We see that all the time, right? When we're on call, patients are on the ER, we gotta get them out quickly, but where are they gonna go? They come oftentimes to our mental health short stay hospitals, right? But these are short stays, 4 to 8 days. And the insurance dictates the length of stays for so many of our patients, right? I just had a patient come in 2 days ago, and they gave me 1 day to take care of him. And I did a review, and they denied it, just saying 1 day is all you get. And then follow-up, right? There's a cliff after patients leave the hospital. Patients may not have insurance. They may not have places that take their insurance. There's not enough providers. We're seeing that too. You know, just having enough providers is something we're working on. And how do you even get to the provider if you don't have a family that can drive you there? Or what if your family's working? We're going to talk about that. And then patients may not take their medications. They might not have insurance to even pick up their medication. And if they do, their insurance may not cover their medications. Some of our long-acting injectable antipsychotics aren't covered by some insurances. And that can create a big problem, and we'll talk about that as well. So those are the slides I have before I bring up Delante and Delante's mom, Trina. And I just want to know if you have any questions before we go into that next piece. Okay, well, why don't you guys come on up? Delante I met in 2014, and I'll let Delante and Trina, and I'm gonna let Delante and you and your mom tell your story.
Okay.
And then maybe in 10 minutes or so, I'll interject a little bit.
Okay, sounds good. May I sit this here?
Oh, of course
Okay.
you can.
Okay. Make sure you're going to. Ooh, cool. Ooh. So we're talking about medications, right? Getting medications correct?
You can talk about.
Oh, sure. Okay. Okay, I'll start this time.
What's your diagnosis?
Oh, yeah. Yeah, I'd rather just read it because I didn't memorize it. Okay. Hello, my name is Delante, and this is my mother, Trina Malone. And we are here to talk a little bit about my mental health journey. On November 3rd, 2020, I hadn't launched my business just yet until I had okay, let's talk more about my illness before I read this. Okay, so Dr. Cutler, I had been what should I call it? What do I call it? Do you want me to read this, or should I just wing it?
His diagnosis is schizoaffective.
Schizoaffective, yeah, that's right. That's right.
2013, and he's been in the hospital a few times. Thank God we had Dr. Cutler.
Yes.
Medication and stuff like that. Oh, I'm sorry. Okay. Let me see what else. He struggled a little bit. Okay, because we didn't know what the diagnosis was. So he turned to alcohol, marijuana, things like that to self-medicate, things like that. And then that's when he spiraled out of control, and then that's when he ended up going in the hospital, and that's how we met Dr. Cutler.
Yes, I also had an addiction. Before I met Dr. Cutler, I had an addiction to the over-the-counter drug Cortesine. I don't know if you guys know what those are. Those are the street drug was, but around that time was triple C's, something like that. Probably don't hear too much about them anymore because I don't think you can even go in the store and get them without ordering them on from Amazon cart or something. So, which is good, which is good. Before that I was addicted to that, and I got off of those because they were burning holes in my memory. I was getting very confused, and so it just wasn't
Trying
good.
to self-medicate. That's the problem.
Yeah, that was
But he eventually,
I've been off of those for very long.
years. He stopped. He had no other choice. And then Dr. Cutler played around with his medication and finally got it right, got him on safe. He hasn't been in the hospital
Since 2016. So this is very helpful, guys. So let's go back maybe in time to when you first started having symptoms,
Okay.
which was 2013.
Yes.
And Delonte, you probably had about 10 hospitalizations in that time as we were going
It
back.
was a journey.
Yeah.
Right? And
Yeah.
and I think the point is that's very common, right? To have multiple hospitalizations, these are short hospitalizations. We can't keep people for a month or 2 months like we used to many years ago, or
Correct.
much longer, like
Yes.
we were talking about earlier.
Yes.
So at the very beginning, I think you talked about your mind was acting on its own.
Yeah.
Do you remember that?
Yes, I do.
And you felt out of control. And maybe talk a little bit about what was going on in your life then in terms of who you were living with, your education.
Yeah, my stepdad, my stepfather, Michael Maxey, we were living with him at the time, and he kind of had a alcohol problem. When he met my mom, though, he quit like he used to smoke, I guess, and he quit all those things just to be with her, And they had been together for 24 years, Mom?
We're divorced now,
Divorced.
but I was married 24 years.
Yes, 24 years.
Did you have to put that out?
Oh, yeah. No. But I guess things just started to decline. He just started to get older, and
Focus
things.
more on you.
So let's talk. No.
Okay.
You're doing great.
Okay.
So how about where you were in school? Were you taking some college classes?
Oh, I was in school for a little bit, and I went to COD for a little bit after I graduated from Naperville Central in 2012. Yes, what was the question? Oh shoot.
About school and you
oh.
were at the college of Dubuque.
That's right,
and
that's
you were
right.
taking classes.
That's right. I was in a business class for a while. I was
And
in
that,
business class, and then I dropped out probably after.
It was overwhelming. He tried. It was just extremely overwhelming.
Yeah, it was extremely long.
and that's when your mind, I think, started acting on its own, as you were saying.
Absolutely.
And that's when you began self-medicating. And I think that's one of the points also that you can highlight is that a lot of our patients, many of them self-medicate to try to manage their symptoms that they're struggling with at the time.
Yeah.
And so that was not a fault of yours in any way. You didn't know how to take care of the way
Yeah.
you were feeling.
Yeah, no. I didn't know. And all my friends were going off to college and stuff, and I was just going to a regular community college, which I got over. I kind of was like, all right, this is normal for my age, I guess, but at that time, it seems a little different now.
Do you remember some of the things that you were hearing, the voices you were hearing?
I don't. That's how much better I've gotten,
So
in a good way.
in a good way, right? And so those voices were saying that they wanted to hurt you.
Yeah.
And that maybe you should hurt yourself.
Yeah.
And at that time, you were talking about how alcohol was balancing out your mind,
Yeah. Oh God. Yeah. Jesus, man.
right? And you made a comment that you felt your head felt like maple syrup.
Yes. Yes.
It-
Very foggy and yeah. Maple syrupy. That's exactly verbatim. Yeah.
Right? And,
what I
and,
said.
and so Delonte was started on a medication called Abilify, which a benefit and something we brought up briefly a few minutes ago is that there's a long-acting formulation
Yes.
of Abilify. One of the problems was getting it, having your insurance pay for it
Oh yeah.
after you left. So staying
Yes.
on that medication became impossible in terms of a long-acting formulation of it.
Yeah. Absolutely.
And that led to, you know, as we said, so many hospitalizations. So after you left the hospital, you came to our day program. We have PHPs and IOPs, everyone in here knows these partial hospitalization intensive outpatient program.
Okay.
But Trina's working, and Delonte needs to figure out how he's going to get from home to our program.
Yeah, absolutely.
And we tried many times, and Delonte, it's hard, right? When you're
Very
working,
hard.
when you're working, no matter who it is, how are we gonna get to program? So Delonte was not able to continue in the program, and we tried this 2 or 3 different
A
times.
few times, yeah.
A few times.
Yeah.
And so that made follow-up care even more difficult. We talked about falling off that cliff. It becomes easy to fall off the cliff if your insurance isn't covering medication, right?
Yeah, right.
We were struggling with that.
Right.
If it's hard to get a ride to the care you need,
Yeah.
That-
Transportation. Absolutely.
that's a very big issue.
I tried transportation too. I actually did transportation when I was working at Toyota, the warehouse for Toyota.
So you understand.
Yeah,
Right.
waiting for transportation
Right.
and things like that. Yeah.
And at the same time, it's hard to even be compliant with medications, especially when you have an illness where it's hard to understand what you're struggling with, right? That
Absolutely.
insight is often not there, and sometimes that's part of the definition, right? So I think what I'm trying to highlight is, right, we talked about the brain, the mind, and the self, and our sense of self is affected so strongly, right? And we're trying to regain that, and Delonte really has, but it hasn't been always so easy. I know there, you know, with your brother, there were things going on with you and him that
Oh, which one?
there was an altercation.
Oh, Zay. Oh,
Yeah.
okay.
Right.
Okay.
But those are common symptoms that people experience.
Yes. Yeah.
Right.
Yeah.
Where there can be some increased irritability and agitation, and that can be hard to manage too, and that leads to legal implications that we see, and our job is to help our patients avoid all of that because they're suffering so much. Before you go ahead.
Oh, me? Oh, yeah. I'm sorry, I missed what you. Just the last part. I think I have to spit my gum out.
No, you're doing great. We talked a lot about transportation. We talked about
Transportation.
medications.
Medications.
We tried a medication called clozapine. That was the medication that you needed to get blood work every week for.
Yeah, that's right. Yeah.
Because that's the medication that is the most effective.
And I did come in thinking oh, I do remember some of the voices I was hearing. So like some of the voices I was thinking like, oh, you okay, so some of the voices I would hear would be like just like just getting checked out cuz I've had girlfriends in the past and just like oh, you need to go get checked out, you have this, you have that, or just things like that. Just always feeling like you need to go to the doctor, go get checked out 24/7, when really I just needed to get my behind up and just stretch, probably do some laps or something. I don't know.
And so getting getting the lab work was difficult too, right? So our most effective medication, which has a lot of side effects, which is why we don't start with clozapine usually, but we have to get blood work for 6 months every week, and then it drops down a little bit after that. But there's always blood work, and that becomes an issue as well. It's very important. But how are you going to get to the blood work? How can you get there every week, right? That makes it very difficult. So that wasn't a medication that you stayed with either,
No.
right?
Yeah, no. We did not.
And another issue, I think, with that medication is you talked about it suppressing your creativity. Because maybe talk about some of the ways you like to be creative.
Some of the ways I like to get creative now, I go on mental health walks. We had a dog pass away from cancer. His name was Teddy. He was a Papillon and a Bichon Frise. So beautiful dog. When I was with my stepdad, when he passed away, we went fishing on the Fox River. Even though we didn't catch anything, we didn't catch nothing. It wasn't nothing. Ever since then, I just kind of I've gone back 3 or 4 times. About 4. That's from where I live. That's about 14 miles. It's a 14-mile walk or more. And I try not to think about that. I try to focus on how I know that there's 5,280 feet in a mile. You can make it. You can do this. Just kind of keep that in mind. And he's walking, and I know he's with me. I know he's with me. Us. Sorry.
It's okay.
Us.
What about some of the music? You're very creative with music.
Oh yes. I've been playing the acoustic guitar for quite some time. Say about 6, 7 years. Is it longer than that? Might be longer than that.
Yeah, he even played for Dr. Cutler.
Oh.
That was great. You're great.
Yeah. I'm getting there. Thank you.
And I think what you were saying at the time was that the medication reduces that sense of creativity.
Yes.
So that sense of self that we have,
Yeah.
it can get dampened a little bit sometimes by these medications, right? And that's something we are concerned about with our patients, and we don't want to take that part away.
Absolutely not.
We just want to take the negative part away.
Yes.
And what about some of what you're doing now to
Mental health bracelets. I make by hand. I make out of polyester. I can use polyester twine. I can use hemp twine. I can use feather twine. I just found out that's new. Without breaking it, which is really shocking. That actually just happened. Trying the feather twine, getting the beads to stay the feather twine, which is really fun. And I also pray when I do them sometimes. So just I just let letting myself know, and I am a Christian, so I letting God know that I know that I'm leaving something here that some kind of foreknowledge or something like that back. Yeah. So is there anything else you wanted to?
So those are all very good points, right? So a bunch of things we've been talking about, right? is
Yeah.
Substance use can be a part of this.
Yes.
Some of the social issues, like just transportation, payment for medication, right? These are some of the issues in the country that we're struggling with. And on an individual level, we see it.
Yes.
We see it very clearly. What questions do you guys have that we can ask? And do you have any questions for Delonte and Trina or both? Yes, here in the front.
I have a question about your mental health walks.
Mm-hmm.
You do those regularly?
I have been recently.
Yeah, I'll repeat the questions. Thank you. Sorry about that. Yes. So mental health walks, are those something that you
Yeah.
do
So
regularly?
yes, but my mom would like me to take shorter mental health walks.
I get nervous because I'll be, oh please, I hope because he's really bad at charging his phone and stuff like that. So I just get a little nervous, but I know he needs it. So I Yeah.
Follow to that. Did you actually walk those 14 miles?
Yes.
The follow-up question is, did you walk those 14 miles?
Oh yeah, and then when I got home, I found out that it was 14 miles. Yeah. I was like, I miss my dog. Wait a minute, 14 miles I just walked.
Other questions? I see.
He was gone for some hours.
What's helped contribute, Delonte, to your health and stability?
What's helped contribute? Support from my family, mainly my mom, and and really just, and also I picked up a new sport that I started doing boxing. Started boxing, yeah. I turned my bed into a bench press, and um, yeah, a lot of Hugh Jackman movies. Yeah, yeah. Oh man. But yes, I practice the splits as well to keep to keep to keep. I just like to be. I don't like for my feet to fall asleep if I'm gonna be gone for a long time. So like I stretch a lot, and I like the yoga and things like that. Yeah.
I think what you said, your answer, family.
Yeah.
Because, excuse me, because when I was thinking about who to ask to come out today, I wanted someone with a wonderful family to kind of show how important that is. And Trina, you are just a wonderful mom. And Delante, you're so lucky to have your mom and vice versa, of course, too.
Absolutely.
You're the best doctor.
Oh, well, no, you can keep talking.
No, I just want to say, because with his insurance and then with different hospitals, they only accept certain ones and things like that. And there was a switch where they didn't take his certain insurance. And this man right here was like, I'm still going to see him. Because it's so important to keep that consistency in the same doctor. These insurance, they just don't care. But the fact that he was like, oh no, I will still see him, that was huge. To have a doctor that cares, that's important, especially in mental health, because they need that consistency.
Other questions? Thank you, guys.
First of all, thank you for being here and being brave enough to sit and tell your story. Because of the stigma, we see so many people hiding and not sharing, so thank you so much for that. How did you overcome the issues? I mean, I don't know if you're on long acting now, or how did you overcome the issues with the transportation to and from where you need to go? And
Thank you. So how did you overcome issues with transportation? How did you become
Well, at the time,
doing so well overall?
yeah, at the time I had, right now we're looking at a car, a nice old school car for like 12. So my mom was like, if I had the money, I would get you this 12K, not that bad. But yes, oh Lord, okay. What was it again?
But he drives. He drives. He
oh.
had a car.
Oh, yes.
That we just junked it, so I'm gonna get him another one. So he's capable of driving himself now. So that's how.
how did you arrange to get him to work?
They have this Ride DuPage program. So sometimes I would just order, and then you just pay like $1 a mile because he's on disability. So I whenever I can, I will set that up for him. Even sometimes when he tried to work, I will set it up, so that helps too as well. Myself, I'm a bus driver myself. I drive for special needs. I've been with my company 28 years. So I deal with all kind of kids, all different kinds. I've been at my job so long because I actually enjoy it and I care, which is why I'm dressed and I'm looking like this, because I'm going to work for my afternoon run. And again, having the type of job, having my summers off, so I was able to be more involved because of my work. That's another thing, because I actually have 5 kids total. They're all grown now. My oldest is 34 and my youngest are twins and they're 26. But I'm a grandma. I have 5 grandkids now. So, but yeah, that's the thing. My schedule, being able to have off, when he was a teenager, I was all up in his business. I was having the type of job that I had, I was able to, so.
That's very true. Very true. I couldn't get away with nothing.
And he was always such a good kid, and you let your guard down and you let them go out and they hang out with their friends, and then here come all this other. I mean, he always, since a child, he had ADHD. Took a while to get that medication right when as a kid, you know. And I remember asking Dr. Cutler when he was hearing voices and stuff like that as a teenager. When he got older, I was like, is it because he smoked weed and the triple C's, is that what caused this mental illness? And Dr. Cutler was like, no, it doesn't cause a mental illness. It was always there because he's always been struggling mentally. But I was thinking, oh my God, I let my guard down, I let him hang out and do all this. And I'm thinking it's because, you know, but whole time it was always there, just didn't know it.
Thank you. Thank you. Other questions? Yes.
Just wondering, it sounds like both of you have had a number of interactions with other families and individuals struggling with schizophrenia. Do you have any thoughts about what you have said and what you might say to family members and individuals who are earlier in the journey struggling with schizophrenia?
Thank you, Dr. Strauss. So what question or what advice can you give to others that are earlier on in their journey of this illness?
Patience. It's going to take a lot of patience.
Yes, a lot of patience. It took a while for me to, like, I can actually sleep at night now. But what was your so that was the man with the nice tie, right? Okay.
Yeah.
I really like the tie.
What advice do you have for others that
I would just say remember to
Stay away from drugs and alcohol.
yes. Oh, absolutely.
help.
Sorry, I'm thinking about color psychology. I don't know why that came to my mind. Mental health. It's okay.
So, and patience, as you said.
Oh, yeah, patience.
was-
But
was
yes,
very
a ton of
important.
patience. That's absolutely patience.
And something else we can see is how, like, disability, right? That's Medicare.
Yeah.
That's getting money from the federal government.
Yes.
And then transportation, that's services through the county we were talking about when you were, but across the country, right? So many counties are funded different ways. They don't have that much money
Yeah.
to help out. And so the system is so, it's so dispersed all over. There's so many counties in Illinois, all doing different things, right? And,
Yes.
and even if you have Medicare, you can't always get the medicines or get the transportation. Or,
true.
And I think that's some of what we're going to be talking about later today also.
All right. Ready?
So no, that makes a lot of sense. We do have a few more minutes, yeah.
For Mom Trina, just with a lot of providers here today, what kind of feedback would you give us as far as like what do family caregivers, parents need as they're helping their loved one through this journey?
Thank you. So the question is, what do families and caregivers need to be helping themselves and their family through the journey?
What do they need? I guess. They really need to care. First off, you have to care.
You need support from other people too.
And yeah, it actually takes a village. Everybody has to be on board. If they're young, the school or the doctors, the family, everybody has to be on everybody. Like I said, it takes a village. And that's pretty much what we had to do to help with him. I don't know what else to say as far as with the providers. I'm not sure. Besides Karen, I know I'm missing something, but.
So that's a good answer. Other questions? One in the back, yes.
So I know a lot of people that struggle with addiction without an extra diagnosis, such with as many symptoms as you have. What do you do now to manage that addiction and not use still?
How do you manage your addiction now so you don't?
Instead of buying a box of Newports, a box of Big Bar, I just switched to a vaporizer, 5%, and just do that. Go to Jay, I go see Jay, you know me.
But you're not using stimulants like you shouldn't be.
No,
You're not-
no, 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 no.
You're
no,
not
no.
using triple Cs.
Oh no. Oh God.
Right.
Just the thought of the.
So how have you stayed away from using those substances?
I'm gonna say, not to cut you off, his walks helps him, and then also the bracelets that he do, that helps him, that helps him as well. And like the alcohol, every once in a while, I must say he's been really good, but every once in a while, he'll drink a beer or something like that, and it's not that often. He's been he used to every day. Now it's like once every couple of months. And I'll just be like, don't you make sure you're not on your medication, and because I can't. He's young, so I mean, so once every couple of months, he will do that. But that's awesome compared to what he used to do. Is just be almost every day if he could.
And to answer
He
an
could go a
earlier,
long time. Actually.
that's very true. And to answer an earlier question,
Absolutely. Yeah.
is that you take a medication, Seroquel, every day,
Yeah. Yes. Every day. Yes.
which has been the one of many that we tried that,
Yeah. Many that
helped
tried,
you.
That helped me. Yes.
which is also another very frustrating part, right? This is probably the 8th medicine you've been on, right?
Yeah,
But
yeah.
it's been this way for many years now.
Yeah.
But it takes a long time to get there, right? We don't have the MRIs to tell us about a lesion or the blood test to tell us about an infection, right?
Yeah.
There's so much trial and error still in treating mental illness. And that's such a frustrating piece of all of this, and that I know is being worked on very diligently. And the more bench sciences side of everything. So
Even that used to make him groggy. It used to be too high, and then
Yes,
remember
yeah,
you
right.
you kept going and you went down, and then finally he got right at the right amount because he'll wake up like really sleepy and tired. So
Yeah.
again, he played with the medication and got it right.
it's frustrating for us as practitioners. It's so frustrating as a patient and a family member to have to see your son and feel that way, feel tired, having side effects,
Yeah.
suffering.
Yeah. She doesn't like to see me that way at all.
Is there one last question? Yes.
Butler, you've been with them throughout this entire journey. What do you think you noticed is like the biggest hurdle that he's jumped through, and like how do you feel about things?
The biggest hurdle that Delante's jumped through is realizing that he needed to get help, I think. And that's some of the times the hardest thing for us as clinicians to help with is to help patients because often they don't have the insight, and just to find ways to work with them and help them understand that this medicine can be helpful in many ways, or this treatment, this psychotherapy, whatever it is at the moment that needs to be helpful, or stopping using medication or substances and starting using medication.
Yeah. Yeah.
So I think that rapport is really important. I think it's essential. And that way you can form a connection, and we all do that, right? We form that connection that becomes so important. And we're fortunate that we've had a chance to work together and help Delante get things feel so much better and move on with your life. So, I'm so proud of you, both of you guys.
Thank you.
And thank you for coming. That was very kind of you guys to come. And I know it's a busy day.
All right, so next we have Dr. Leslie